Constitution is clear about the rights of all who are in South Africa and what they can access from public facilities. But the vigilante group Operation Doula has tried to block migrants and other foreign nationals from accessing healthcare services at various clinics, most notably the Hillbrow Clinic. And the Human Rights Commission has been invited to help us understand what can be done and how is this going to be dealt with. Commissioner at the Human Rights Commission, Sandra Makoasha, joins us now. A very good morning to you, and thank you so much for your time.
Good morning to you and your listeners.
As I said in my introduction, the Constitution protects all who live in South Africa. Section 27 says no one, citizen or not, should be denied emergency medical care. What is your view then of attempts by Operation Doula to block migrants from accessing clinics?
I think the Human Rights Commission is concerned that these are civic organizations and individuals that are taking the law into their own hands. When we have specific departments such as the Department of Home Affairs as well as the South African Police Service who are lawfully mandated to carry out that mandate. And often this results in tensions and the continuous violation of human rights of those who really need access to healthcare services.
Well, at the point that they start taking the law into their own hands, they start becoming civic organizations, they become vigilante groups.
That is correct, and we hope that the court case and the reserve judgment and our oral submissions in that case does then highlight the importance of the law and respecting the law of South Africa.
Why do you think that in some cases it's been reported that as they do this, law enforcement officials stand by and look the other way?
The South African public is frustrated by infrastructure challenges, systematic challenges in South Africa, specifically in the healthcare. And often when they don't have solutions, they look for someone to blame, cost responsibility to. So often, and South African Police Service has been, I think in some of the videos we've noted, is when they do assist, they are then accused of being corrupt, when they are supposed to be doing the law and ensuring that everyone is given access to the healthcare facilities in terms of Section 27.
But we're not only seeing Operation Doula, we've also seen videos being circulated on social media where officials within the healthcare system themselves are treating these migrants differently in terms of access to healthcare.
And that's a clear violation not only of the mandate as healthcare practitioners, but it's a clear violation of Section 27.1. And I think you said emergency, but in terms of Section 27, it says everyone has the right to have access to healthcare services, including reproductive healthcare. So they really need to understand that we are a constitutional democracy, and turning away and people based on their nationality is a clear violation of South Africa's constitution, but also we've signed treaties as a nation in terms of universal health care. So then it results as a country we are violating those treaties. Shouldn't
there be tougher consequences for those violations?
We are waiting for the outcome of the judgment. We are hoping that the South African Police Service advises those who are taking the law into their own hands, and that we see that repercussions are taken. We need to continue to respect the rule of law. And as you note in our statement, we say that we hope that the Department of Home Affairs and the South African Police Service do their work before citizens take the law into their own hands.
What can you as the Human Rights Commission do?
We are continuing to monitor the situation. We have received individual complaints. We've made oral submissions in terms of the case that was taken by Kopanang Africa. So we are working. We're also then dealing with the systematic issues. Without dealing with the systematic issues, we have vulnerable members of the communities challenging each other, taking the law into their own hands, fighting for limited resources, when the real concern is how do we then address the systematic issues.
How do you deal with supporters of the Human Rights Commission who might say you're on the right side of this in terms of what the Constitution says, but in effect, there's not much you can do? And of course, those who might be opposed to you who will say you are putting the interests of foreign nationals who are undocumented here illegally above those of South Africans. How do you respond to those two charges?
Let me start with the last charge, because I think that's the charge that we are going to continuously be hearing in the next few days about the Commission, and we've always heard this. The mandate of the Commission is to protect the Constitution, is to educate on the Constitution, and we do what the Constitution requires us of. Therefore, we will act in terms of the constitutional mandate given to us without fear or favor to ensure that we then protect the constitution of democracy. Should we fail to do so, we will result in continuous human rights violations and the violation of our Constitution, which we're so proud of as a nation. In terms of the next charge, it's correct that we will then remind not only the general public of the constitutional mandate, but also those who are mandated to, in terms of the healthcare and facility, the politicians, those who are providing services, the public employees, that this is the Constitution, please respect it. And while we're doing that, we are going to Parliament making submissions in support of budgetary improvements to ensure that these systematic issues are then addressed. But we're also then speaking with the relevant MECs of health nationally on an action plan to resolve some of these challenges, which then trickle down to the general public.
It was 2 years ago when the Gauteng High Court ruled that pregnant women and children under 6 years old must have free access to public health services regardless of nationality. But here we are 2 years later having the same discussion. Sandra, Makoasha, appreciate your time, Commissioner at the South African Human Rights Commission.
Current events, developing stories,
tough questions.
Your voice making a difference.
This is Breakfast with Bongani Bingwa.